Good morning and welcome. I'm just done with my morning rounds, and today we continue with our VTE series where we learn about DVT versus pulmonary embolism and why the distinction matters. Remember, DVT is a clot in the deep veins of the leg, while pulmonary embolism is a clot in the lungs. There are two stages of the same process, one being deadly and can be fatal. So let's break it down in simple terms. We start off with DVT. DVT, or deep vein thrombosis, is a clot in the deep veins, mainly in the lower limbs. This is in the legs and can rarely occur in the upper limbs, arms, or even in the veins in the brain, which is what we call cerebral vein thrombosis. How do you recognize if you have a deep vein thrombosis? We have said the main location is the lower limbs, in the leg and in the leg. In the leg and in the thigh. You have swelling of the leg. Swelling of the leg is warm to touch, the leg is also tender, and you have difficulty in walking. The key learning point is that any unilateral leg swelling is DVT unless proven otherwise. If you notice any swelling of one leg, calf tenderness, warmth to touch, think DVT and go to hospital so that it is picked early and treated to prevent progression to pulmonary embolism. So pulmonary embolism, or PE, is when a clot breaks from the legs, travels through the bloodstream up to the lungs. It blocks one of the vessels in the lungs, reduces blood flow from the heart, and causes sudden collapse and can even lead to death if not picked early. Please note, pulmonary embolism is fatal. It is usually silent and missed most of the times. How do you recognize if you have pulmonary embolism? So if you have DVT or swelling in your leg, you are at risk of pulmonary embolism. You need to notice the signs that occur. If you get shortness of breath, which occurs suddenly, you are having difficulty in breathing. There is chest pain on breathing in, what we call pruritic chest pain. Think of pulmonary embolism. You can also cough blood, what we call hemoptysis. Coughing blood is a danger sign. And fast heartbeat or palpitation. So we have said PE, which is a great masquerader, you recognize by shortness of breath that occurs suddenly, chest pain on breathing in, coughing blood, hemoptysis, or palpitation. If you notice any of those signs of recent onset, think pulmonary embolism, you need to act fast and rush to hospital immediately. We have said DVT and pulmonary embolism are two stages of the same disease process. We need to recognize and pick DVT early so that you can prevent someone from getting pulmonary embolism. We should recognize the clot and recognize it early. Any unilateral leg swelling, any one leg swelling is deep vein thrombosis until proven otherwise. And if you have had a history of leg swelling and suddenly develop breathlessness, chest pain, difficulty in breathing, you need to think pulmonary embolism and rush to hospital fast, where the necessary tests will be done and treatment initiated. Remember from our discussion, many people have been saying they have lost their loved ones suddenly because of pulmonary embolism, or even pulmonary embolism discovered during post-mortem. Let's be alert, let's be aware. Sudden onset breathlessness, chest pain, difficulty in breathing, think of pulmonary embolism, and pulmonary embolism is treatable. Stay tuned. Tomorrow we'll discuss the major risk factors that you need to be aware if you are at risk of pulmonary embolism. Dr. Muthui-Mutua, saving lives one heart at a time.